Hello, moms and moms-to-be. Are you about to embark on the incredible, yet sometimes daunting journey of breastfeeding? Wondering how to ensure your baby is getting enough nutrition? Worried about sore nipples or low milk supply? In this comprehensive guide, we'll unravel all the secrets to successful breastfeeding. In the next few minutes, you'll learn proven techniques for a perfect latch, discover how to naturally increase your milk supply, and master the most comfortable breastfeeding positions. Plus, we'll tackle common challenges every mom faces and how to overcome them with confidence. By the end of this video, you'll have all the tools you need for a rewarding, stress-free breastfeeding experience. Whether you're a first-time mom or already have experience, this guide will transform your breastfeeding journey. Ready to become a breastfeeding expert? Let's dive in. First, let's talk about the incredible benefits of breastfeeding. For your baby, breast milk is a powerhouse of nutrients, perfectly tailored to their needs. It's packed with antibodies that boost your little one's immune system, reducing the risk of infections, allergies, and even certain chronic diseases later in life. Breastfed babies have a lower risk of sudden infant death syndrome, SIDS, and they're less likely to become overweight or obese as they grow. But it's not just about the baby, moms reap significant benefits too. Breastfeeding helps your uterus contract back to its pre-pregnancy size more quickly and can lower your risk of breast and ovarian cancers. It's also a natural way to burn extra calories, helping you shed that pregnancy weight. Plus, the hormones released during breastfeeding can have a calming effect, reducing your stress levels and risk of postpartum depression. Now, let's explore the fascinating world of lactation anatomy and physiology. Your breasts have been preparing for this moment since early pregnancy. The milk-producing cells, called alveoli, are clustered in groups called lobules. When your baby suckles, it triggers the release of two key hormones, prolactin, which stimulates milk production, and oxytocin, which causes the milk to flow. This let-down reflex is crucial for successful breastfeeding. Preparing for breastfeeding starts during pregnancy. Attend prenatal classes, read reliable resources, and consider consulting with a lactation specialist. Your nipples don't need special preparation, they're naturally ready for the job. After birth, skin-to-skin contact and early initiation of breastfeeding are crucial. Try to breastfeed within the first hour after delivery. This early colostrum is liquid gold for your newborn. Lastly, let's cover the essentials you'll need for a smooth breastfeeding journey. While you don't need much, a few key items can make a big difference. Invest in a good nursing bra for comfort and easy access. A nursing pillow can help position your baby correctly and save your back and arms from strain. Nursing pads will be your best friends for those inevitable leaks, and a quality nipple cream can soothe sore nipples. Don't forget a comfortable chair or spot where you can relax during feeding sessions. Remember, every breastfeeding journey is unique. What works for one mom might not work for another. Be patient with yourself and your baby as you both learn this new skill. With the right knowledge and support, you're setting the stage for a beautiful breastfeeding experience. Mastering the art of breastfeeding is crucial for both you and your baby's comfort and success. Let's dive into the essential techniques that will make your breastfeeding journey smoother and more enjoyable. First, let's explore the correct breastfeeding positions. The four main positions are: cradle hold. This classic position involves cradling your baby's head in the crook of your arm on the same side you're nursing from. Support your baby's back and bottom with your forearm and hand. Cross cradle hold, similar to the cradle hold, but you use the opposite arm to support your baby. This gives you more control over your baby's head, which can be helpful when learning to latch. Football hold, hold your baby at your side, with their legs tucked under your arm like a football. This position is great for mothers who've had a C-section or have large breasts. Side lying position, lie on your side with your baby facing you. This position is perfect for nighttime feedings or when you need to rest. Remember, comfort is key. Use pillows to support your arms, back, and baby as needed. Now, let's talk about achieving the perfect latch. A good latch is crucial for effective milk transfer and to prevent sore nipples. Here's how to recognize a good latch. Your baby's mouth should be wide open, like a yawn. Their lips should be flanged outward, not tucked in. More of your areola should be visible above your baby's top lip than below. You should hear rhythmic swallowing after your milk lets down. If the latch is painful or you hear clicking sounds, gently break the suction and try again. Regarding feeding frequency and duration, remember that newborns have tiny stomachs and need to eat often. In the early weeks, expect to nurse 8 to 12 times per day, or every 2 to 3 hours. Each feeding session can last anywhere from 10 to 45 minutes. As your baby grows, they'll become more efficient and may spend less time at the breast. It's crucial to feed on demand rather than on a strict schedule. Look for these hunger cues. Rooting, turning head and opening mouth. Putting hands to mouth. Increased alertness or restlessness. Sucking motions or sounds. Early hunger cues are the best time to start a feeding. Crying is a late sign of hunger and can make latching more difficult. Signs that your baby is satisfied include releasing the breast on their own, falling asleep at the breast, relaxed hands and body, wet and dirty diapers in the expected amounts. Remember, every baby is different. Some may nurse quickly and efficiently, while others prefer to take their time. Trust your instincts and your baby's cues, and don't hesitate to seek help from a lactation consultant if you're unsure. While breastfeeding is natural, it's not always easy. Many mothers face challenges along the way. Let's discuss some common issues and their solutions to help you overcome these hurdles. First, let's address sore nipples. This is often caused by improper latch or positioning. To alleviate this, ensure a deep latch with baby's mouth wide open. Break suction properly before removing baby from the breast. Apply expressed breast milk or lanolin cream after feeding. Use breast shells to protect sore nipples between feedings. Engorgement can occur when your milk comes in or if you miss a feeding. To manage this, nurse frequently to prevent overfullness. Use warm compresses before feeding to encourage letdown. Gently massage breasts while feeding. Apply cold packs after feeding to reduce swelling. Mastitis, an inflammation of breast tissue, can be serious. Symptoms include breast pain, redness, and flu-like symptoms. If you suspect mastitis, continue breastfeeding or pumping to prevent clogged ducts. Rest and increase fluid intake. Apply warm compresses to the affected area. Consult your healthcare provider, as antibiotics may be necessary. Now, let's discuss strategies to increase milk supply. Nurse frequently and on demand. Ensure proper latch and positioning. Stay hydrated and maintain a balanced diet. Consider power pumping in short, frequent sessions. Some mothers find herbs like fenugreek helpful, but consult your doctor first. Returning to work while breastfeeding can be challenging. Here are some tips. Start pumping and storing milk a few weeks before returning to work. Familiarize your baby with bottle feeding. Discuss pumping breaks with your employer. Maintain skin-to-skin contact and frequent nursing when you're together. Lastly, let's cover milk expression and storage. Choose a pump that suits your needs, manual, electric, or hospital grade. Wash hands thoroughly before expressing. Store milk in clean, food-grade containers or bags. Freshly expressed milk can be stored at room temperature for up to 4 hours, in the refrigerator for up to 4 days, and in the freezer for 6 to 12 months. Thaw frozen milk in the refrigerator or under cool running water, never in the microwave. Remember, these challenges are common and temporary. With persistence and support, you can overcome them and continue your breastfeeding journey. As a breastfeeding mother, your nutrition and overall well-being are crucial not only for your health but also for your babies. Let's explore how to take care of yourself during this important time. First, let's discuss a balanced diet for lactating mothers. Aim for an extra 300 to 500 calories per day above your pre-pregnancy diet. Focus on nutrient-dense foods like lean proteins, whole grains, fruits, vegetables, and healthy fats. Include foods rich in calcium, iron, and omega-3 fatty acids. Consider continuing your prenatal vitamin or switching to a postnatal supplement. Be mindful that some foods may affect your baby through breast milk, e.g., spicy or gassy foods. Hydration is key for milk production. Drink water throughout the day, aiming for about 8 to 10 glasses. Keep a water bottle nearby during nursing sessions. Other hydrating options include milk, herbal teas, and water-rich fruits. Limit caffeine intake to 300 mg per day, about 2 to 3 cups of coffee. Proper supplementation can support your health. Vitamin D is often recommended, especially if you're deficient. DHA supplements can support your baby's brain development. Consult with your healthcare provider about any additional supplements you may need. Mental health is just as important as physical health. Be aware of signs of postpartum depression and anxiety. Don't hesitate to seek professional help if you're struggling. Practice self-care regularly, e.g., taking baths, reading, or meditating. Accept help from family and friends to reduce stress. Join a breastfeeding support group to connect with other moms. Exercise can benefit both your physical and mental health. Wait until you're cleared by your doctor before starting any exercise routine. Start slowly with gentle exercises like walking or postpartum yoga. Gradually increase intensity as you feel comfortable. Wear a supportive sports bra and nurse or pump before exercising. Stay hydrated during and after workouts. Listen to your body and don't push yourself too hard. Remember, taking care of yourself is not selfish, it's necessary. A healthy, happy mom is better equipped to care for her baby. Don't hesitate to reach out for support when you need it, whether it's from your partner, family, friends, or healthcare providers. As your baby grows, your breastfeeding journey will evolve. Let's explore the next steps in your child's nutrition and development, as well as important information to support your ongoing breastfeeding experience. Introducing solid foods. The World Health Organization recommends exclusive breastfeeding for the first 6 months. Look for signs of readiness, good head control, sitting up with support, showing interest in food. Start with single-ingredient purees, e.g., rice cereal, mashed banana, or avocado. Introduce new foods one at a time, waiting 3 to 5 days between each to watch for allergies. Continue breastfeeding alongside solid foods. Breast milk remains an important source of nutrition. The weaning process. There's no set time to wean, it's a personal decision for each family. Gradual weaning is often easier on both mother and baby. Start by dropping one feeding at a time, usually the midday feed. Replace breast milk with age-appropriate alternatives, formula for under 1 year, whole milk for over 1 year. Be prepared for emotional changes. Weaning can affect hormones and mood. Support and resources. La Leche League International offers support groups and resources worldwide. Many hospitals and birthing centers have lactation consultants available. Online communities can provide peer support and advice. Your pediatrician or family doctor can address concerns and provide guidance. Books and reputable websites can offer additional information and tips. Myths and truths about breastfeeding. Myth: you can't breastfeed if you're sick. Truth: in most cases, it's safe and beneficial to continue breastfeeding when ill. Myth: breastfeeding mothers need to eat special foods. Truth: a balanced diet is sufficient, no specific foods are required. Myth: small breasts produce less milk. Truth: breast size doesn't affect milk production capacity. Myth: breastfeeding prevents pregnancy. Truth: while it can suppress ovulation, it's not a reliable form of birth control. Myth: pumping can tell you how much milk you're producing. Truth: babies are often more efficient than pumps at removing milk. Remember, every breastfeeding journey is unique. Trust your instincts, seek support when needed, and celebrate your accomplishments along the way. Whether you breastfeed for weeks, months, or years, you're providing your baby with invaluable nutrition and bonding. As we wrap up our comprehensive guide to breastfeeding, let's take a moment to recap the key points we've covered. We explored the numerous benefits of breastfeeding for both mother and baby, from nutritional advantages to emotional bonding. We discussed proper breastfeeding techniques, including correct positioning and latch, which are crucial for successful feeding and preventing discomfort. We addressed common challenges like sore nipples and engorgement, providing practical solutions to overcome these hurdles. We emphasized the importance of maternal nutrition and self-care, highlighting how taking care of yourself directly benefits your baby. Finally, we looked beyond the initial stages of breastfeeding, discussing the introduction of solid foods and the weaning process. Remember, every breastfeeding journey is unique. There may be challenges along the way, but with patience, persistence, and support, you can overcome them. Trust your instincts and don't hesitate to seek help when you need it. To all the new and expectant mothers out there, we want to say, you've got this. Your body is capable of amazing things, and you're providing your baby with the best possible start in life. Be proud of every step in your breastfeeding journey, whether it lasts for weeks, months, or years. Breastfeeding is more than just nutrition, it's a special bond between you and your baby. Cherish these moments, even during the tough times. They're laying the foundation for a lifetime of love and connection. Remember, you're not alone in this journey. Reach out to lactation consultants, join support groups, and connect with other breastfeeding mothers. Share your experiences, learn from others, and celebrate your successes together. Thank you for joining us on this exploration of breastfeeding. We hope this guide has empowered you with knowledge and confidence as you embark on or continue your breastfeeding journey. Here's to happy, healthy mothers and babies everywhere.